The union representing hospital workers across Ontario, including the Northeast, is calling on the province to increase healthcare funding. It adds that without more resources, the crisis in hospitals will continue. CTV's Angela Gemmell reports.
You need 23 extra beds just to maintain service levels.
Researcher Doug Allen points to a graph showing a need for more hospital beds in Sudbury. The stats are part of a new projection report.
We need a bump up in hospital funding for this fiscal year, and we need a budget that allows hospitals to plan and to develop and grow and serve their communities so that we don't have this crisis getting worse and worse.
The report is from the Ontario Council of Hospital Unions, a division of the Canadian Union of Public Employees. It says hospitals have been told by the province to plan for 2% funding increases over the next few years, which is a drop from the 6% average in recent years. The union is predicting projections based on the new funding figures and is concerned the shortfalls will lead to job losses, reduced hospital beds, and higher wait times.
Really, we're saying that there needs to be an injection of resources into the hospitals to allow them to cope with the pressures of an aging and growing population, and cutting them is completely unacceptable.
In an email to CTV News, the Ministry of Health calls the claims misguided and adds, in part, we continue to make record investments in our healthcare system, including investing $91.5 billion this year alone. This includes a 4% increase in investment to the hospital sector for an unprecedented third year in a row. The duo is touring the report around the province, including in northern Ontario, where there's been job cuts at the hospital in North Bay, high capacity issues in Sudbury, and continual closures in the Algoma region.
The hospital emergency room shutdowns that we've seen have occurred in smaller communities because that's where the crisis first manifests. We're very worried about what will happen in the north.
The ministry reiterates the changes being made by hospitals are for efficiencies and don't affect patient care. Without extra funding, the union says the crisis in Ontario hospitals will worsen and translate to a 3 to 4% decline in quality patient care. It wants the provincial government to invest in multi-year commitments to stable funding. Angela Gemmell, CTV News, Sudbury.